CataractCoach.com. The oculight ichopper makes phaco-chop so safe and easy. You can learn. Let me show you in this promoted video.
So place the chopper at the equator. There you go. Now when you tilt the chopper around, you get the hook sign. Now you know it's correctly positioned. Perform the chop and separate the two pieces. And the only illumination here is from the chopper, not the microscope.
Now that you understand how it works, let's show you this video of Dr. Christos Ifantidis doing a routine phaco-chop case. So in the left hand is the eye chopper, and you can see the illuminated tip. When you place this inside the eye, look how it just lights everything up. It's so easy to see the capsulorhexis margin. Buzzing with the phaco probe, here's chopper placement around the equator, and that light enables you to see exactly where the chopper tip is at all times. Now propagating the chop, and look at the illumination. Absolutely beautiful. Highlights all the important structures like the capsulorhexis, the anterior capsular rim, the capsular bag equator. Again, placing this around the bag equator. There's the hook sign that we talked about, and you can chop it. Now, using it this way in combination with your regular microscope lighting, you can actually decrease the amount of light used from your own microscope. In videos that I'll show you coming up, we can do it without even any microscope lighting, using just the illuminated chopper. Again, rotating the nucleus around, so easy to now remove the pieces. If you want to, you can sub-chop it more. These aspirate pretty easily. And then again, let's watch in action with the phaco chopper as we do the second half of the nucleus. So there's the second half coming up. Chopper goes around it. Such great illumination. You can see everything. So easy to chop off little pieces. And the rest of the case is very much facilitated. So really great instrumentation. What a novel idea of having an illuminated chopper tip. Really makes it easier for you to learn phaco-chop and also makes it easier for complex cases, which I'll show you coming up in just a moment here. Cataract surgeons want to learn phaco-chop. Why? It's the most efficient way of nucleophractus. Far more efficient than doing things like divide and conquer or even stop and chop. But the challenge is, it's hard to learn phaco-chop. When you're doing horizontal chop, well, where's the chopper going? Did you avoid the capsulorhexis? Did you get around the lens equator? There's a new invention. Check this out right here. The eye chopper. This is an illuminated chopper. There's a fiber optic cable from this light source, and that goes to the tip of the chopper. So when you place the chopper inside the eye, it is a lighted tip. You can easily see where's the capsulorhexis, place the lighted tip around the lens equator, perform your chop. You can also decrease the amount of illumination that you need in order to perform the surgery. Now, there have been multiple studies that have been published about this. Last year, in JCRS, there was a study showing that in routine eyes, it made the surgery more efficient, and you could use less light too, so easier for the patients. There's a published study in the Indian Journal of Ophthalmology showing that for complex cases of floppy iris or iris prolapse or iris damage, small pupil, in iris complicated cases, it was very helpful. And even a study in the European Journal of Ophthalmology showing that for femtosecond laser-assisted cases, it actually provides a benefit as well. So it's a really neat device. There's actually a new ongoing study coming out in the US with people you know, Christos Ifantidis, Lisa Park, Brian Kim. They're all participating in a study showing that for routine cases, this makes the surgery more efficient for you, takes less time, and also safer for the patient, and you can use less light, so the patient is not so sensitive to your bright microscope lights. So let me show you a couple of videos of this in action. I think you're going to be amazed. Now let's watch a complex case here. Corneal scar. Patient also has floppy iris syndrome, IFIS. And you can see using the endoillumination from the chopper tip really facilitates capsulorhexis creation. Now you could not get this view from standard microscope lighting. So having the endoilluminator, look at the difference here. This is the regular view, but when you have the endoilluminator, how it lights up that anterior capsule so easily. And now as you come here to this corneal opacity, you can operate underneath it. You don't have any light reflecting off of the corneal opacity. Turn off the microscope lights. There you go. And you complete a beautiful capsulorhexis here. Makes it so easy. Now watch during the nucleus removal, turning off the microscope lights using just the endoillumination from the chopper. There's the placement of the chopper. There you go with the hook sign. Propagate the chop through. Very easily done. Rotate the nucleus. And again, such great visualization. Look carefully. You can even see the capsulorhexis margin so beautifully lighted up. Now, rotating around more and more, get these pieces out. And you can see the pupil is coming down. This is a floppy iris case where the pupil's getting mad. This was that study that was published earlier showing that for complex iris cases like this, you can really have a huge benefit by using endoillumination. And using this ichopper really does make life a whole lot easier here. So aspirating these pieces out, you can see very efficient nucleus removal despite the small pupil. And you get great visualization at all times. You can see very easily there's the rest of the nucleus being removed, a little bit of cortex left in the capsular bag. Even cortex cleanup is going to be facilitated by having endoillumination. So there we go. Nucleus is out. Look how much the pupil came down. And again, the view is particularly challenging because of that large corneal opacity here. But with the endoilluminator on from the chopper and the microscope lights off, look at the visualization. You can see the complete capsular bag. You can ensure that all cortex has been removed, cleaning up really nicely, and again, turns a difficult case into a very easy case. Now you understand that previously published study that we had from the Indian Journal of Ophthalmology I showed you earlier in this video that showed it really made a huge difference in these complex cases with iris challenges. So again, we always have these patients in our clinic with the small pupil, the floppy iris, the Flomax, the iFis, iris prolapse, you name it, the works. This just makes it a whole lot easier. So again, finishing aspirating out that lens cortex, cleaning up that capsular bag, and then very easy to finish the case, get the lens in, and call it done. So it really makes life a whole lot easier to use this source of endoillumination for both the chopping and the surgery. Let's go back again to show you Christos' video just to emphasize how easy this makes it. Placing the phaco probe there, here comes the chopper tip going around the equator, there's the hook sign, and split the nucleus into two halves. I promise you, you can learn this. Phaco chop will transform the way you do cataract surgery, and using this ichopper is going to make it a whole lot easier. Again, bury the phaco tip here, chopper goes around the equator, very easy to see, and split the nucleus in two pieces. Beautifully done. As you can see from these videos, the ichopper from Oculight provides some tangible benefits that could make you a more efficient surgeon, or if you're a beginning surgeon, help you to learn phaco chop. I promise once you learn phaco chop, you're not going to go back to other techniques of nucleofractus. It really is that good. There's more information down below. You can see the links, and I want to thank you again for watching this promoted video.